This is WCN, the Whole Care Network. You talk, we listen. Content presented on the following podcast is for information purposes only. Views and opinions expressed during this podcast are solely those of the individuals involved and do not necessarily represent views of the Whole Care Network. Always consult your physician for medical and fitness advice, and always consult your attorney for legal advice. And thank you for listening to the Whole Care Network.
Have you ever met anybody that has caregiving on their bucket list of things to do in life?
Beyond caregiving, how do we care?
We also have to care for ourselves.
How do we treat friends, family, strangers we meet?
Forget it.
How do we heal? The physical, social, financial, spiritual.
Hello.
By creating healing ties. Tying it all together like a bow tie. With your host, Christopher McClellan, the bow tie guy.
Well, greetings, everyone. It is Christopher McClellan. You might know me as the bow tie guy for another episode of Healing Ties 2.0. Thanks for joining me today. On Healing Ties, we are all about sharing stories and information because we believe that it is through story sharing where diversity meets the road to combat a common cause. And our common cause is to help you create healing ties to live happy and healthy by caring for yourself and others before, during, and after caregiving ends. And as you know, we're celebrating National Family Caregivers Month with the reboot of Healing Ties podcast and the soft launch of our new Whole Care Network website. And when you get a chance, please visit our new website at thewholecarenetwork.com, where you'll get the opportunity to meet Bo, because Bo ties things together on the Whole Care Network. When you see Bo, you'll get it. I just know that you will. During our soft launch, we're asking our listeners to provide us with feedback on the new site so we can continue to build the site in a way for you to easily find important information and resources via your favorite podcast, blogs, and videos. And one of the unique features of our new site is the ability to search for content via our Whole Care Network 4 pillars of care: our physical, social, financial, spiritual / holistic health, because we all know that everybody has a different opinion when it comes to spirituality. But I'm looking forward to receiving your feedback on the new site, and be on the lookout for our new 24/7 streaming radio channel debuting in early 2021. Goodness, well, enough for me. My guest today, I'm just really excited, is the CEO and founder of Beacon Advocates, Lea Ann Biafora. Lea Ann has a unique combination of experience as a certified oncology nurse and as a leader in the healthcare industry. Lea Ann keenly understands the importance of patient advocacy and created a concierge care management model that treats individuals living with cancer holistically as an individual person, not simply as a patient. And Lea Ann, it is great to see you, reconnect with you, and have you on the podcast. Thanks for joining me today.
Well, thank you, Chris. It is an honor to be with you today. I equally look to you and with such admiration for what you're doing.
Well, we're all connected through our stories, and you use such a wonderful word that means so much to me: advocacy. I firmly believe that being an advocate really is a healing component for caregivers, especially after caregiving ends, because we're so filled with all this information that we want to be able to share. And And it's through advocacy that heals us. But enough of my story. I want to hear a little bit more about yours. Tell us a little bit about your story and Beacon Advocates.
Sure. Well, thank you again for having me on today. I do like to talk about it, about what drives me. I'm truly passionate, consumes me. I've been an oncology nurse for 30 years. And I think when I went into this field, I quickly learned that the system was broken. And this was in the early 90s. And I realized at that time that and at the time I had just started, I just finished my nursing degree. And I knew I needed to go back to be able to to create solutions to this problem. One particular I visually see this in my head is, when I had multiple patients on a med surg floor, and I had a Vietnamese a family who were being discharged and had there was nothing in Vietnamese, and I had to give them discharge instructions. And I thought to myself, well, how is this possible? And meanwhile, I had 7 other patients on a busy city hospital in Boston. And I had a fresh post-op, someone that was going septic. And then I had all of these other range full of intensity, levels of intense cases. And I thought, this isn't the way to deliver good care. And so I looked at university-based hospitals, and I ended up going to Emory University and finished up and started going towards my finishing up with my master's in nursing. And halfway through that, I realized I was really focused on the quality aspects of cancer care and within quality, and how to really measure that. And so I focused and switched into healthcare administration. And then by that time, I was a caregiver myself for an aunt up in Massachusetts. So I went back from Georgia to Mass to help her transition as she was in hospice and transition. We have a small family, so I was very important for me to be there. And when she transitioned, I went back to Boston and started my master's in nursing. I thought I was going to finish that up, and ended up going into healthcare administration and worked in case management. So for a large hospital, I had 50 to 100 cases a day, and It was all related to cancer. And what was beautiful with that situation was I was able to team up with social workers. So it was a really unique model that had nursing, social workers, and then it was a multidisciplinary team. So we would have team meetings with the physicians. And it was just such a beautiful and effective way to get things done. Now, of course, it was in the city. So you're not in the community setting. You're in typically very, intense cases where people are very sick. And then as you're discharging them to either different facilities, different home settings in either hospice or home with services or medications, that's where I really got the learning, the details of the challenges of healthcare and delivery of cancer care. And so after that experience, I finished my master's during that time and went back to work full time for a large cancer center in Boston, and worked on delivering pathways, like getting better coordinated care, getting all the physicians on the same page, which is, Harvard.
That's a challenge in and of itself.
Yeah. So I learned a lot. I had a lot of wins, but I had a lot of fails, and it just really pointed to the challenges of healthcare. And so all of these, by this time, I was probably a good almost 10 years into it. And I realized it just was very clear the issues where patients were really did not have that center of, they weren't the intricacies of their needs were not first. It was putting a round, as I often describe, putting a round piece into a square hole. And it just was not, it never felt good, right? It never felt like, and so I worked alongside of my social work partners and an incredible woman, Susan Block, and we put together we try to get more integrative therapies and with our patients relations folks as well. And we started creating more, wanting that holistic view of the psychosocial aspects with the medical and really trying to address people's needs. Because it really, physicians, the system is based on physicians, right? That's a very physician driven, and physicians are really designed, or their role is really designed to focus on the disease.
Exactly.
Fix the disease and not the whole person, unfortunately. Right. And so the nurses and ancillary staff are the ones that really do take care of those, try to do their best in their settings to try to address those needs. And so after that time with the acute care setting, I went into more population-based within insurance. And I learned that was when my eyes really started opening up. Like you can get a lot from data, you can see a lot, but knowing always in the back of my mind of, behind those claims data are people, and really seeing those challenges that continued, and created with a team, created a program for early detection and early navigation for breast cancer. And this was in Boston again. Very, very innovative before, around 2000. And it was really trying to meet the people where they were and guide them, guidance through that diagnostic process. And that just started my further commitment to improving the care experience. And fast forward a lot of different stories. I created a company in 2012 to design to really improve the cancer care experience. And that means getting the best cancer care, addressing what's important to you. What's important to you, Chris, might not be as important to me. Right?
Exactly.
And trying to address and mitigate any type of risk for payments and things that really are the common stressors. And then really trying to utilize my background with helping to educate and look at treatment options and mitigate those, reduce those barriers. I think the most important thing that we have brought to the table, and the reason we're so successful, is because we are independent. And I think that's the key. As an independent advocate, that's where we have the most, combined with our knowledge of the healthcare system and our knowledge of the disease and how to navigate within both of those systems, we are able to be more effective as a patient advocate.
And it's so critical to have that objective third person involved in your care, because when we get the diagnosis, it's a shock. My listeners hear me say this all the time, caregiving happens because of two things: an unfortunate accident or an untimely diagnosis. And suddenly you're thrust into this medical field. And not all of us are not well versed in how to deal with the intricacies of healthcare. And that's why it's so important to have an advocate that can be there on your side.
Yes. It's like being thrown into Latin, a whole new, back in the dark age. Yeah.
You're getting me in my seminary days there. The Latin, that's all Greek to me, we used to say.
It is, and even those who are well versed in this, in the healthcare system and how it works and cancer care. I mean, take me, for instance. I had cancer, and that was a very interesting experience, because you can't be objective when you're a patient, right? Even the most seasoned individual, it really is such a shock to your system, especially as an oncology nurse of many years. I thought, oh, well, this couldn't happen to me. I'm infallible.
Right.
And that in true, 1 in 8, it just doesn't work that way. So it was my own personal experience. It was a very interesting journey, and maybe another day, but for another story. But I think that it really does. It has helped my business by that empathy, that sense of empathy, that sense of that feeling like one foot is off the edge, and being able to say, no, we're here, right? We have you. We're gonna be your best advocate for you, because we're gonna help guide you through this journey. And we're not there to influence you by putting our own bias. We're here to give you the science to help you and ask questions. And we don't know all the answers because we're not physicians, but we know how to get a lot of information, right? We know how to navigate within the scientific guidelines. We know how to ask the right questions of the physicians. And if your physician is not asking or responsive or is limiting, then we sometimes have to go to the next physician.
It's that hierarchical structure that we're, at least folks like myself who grew up in the 60s, we all think that the doctor, they're all knowing, they're all seeing, they have all the information, but that's not necessarily the truth. That's why it's so important for folks like yourself to be there to advocate.
Yeah, it really.
For
You're
patients.
Right. You're right.
Go ahead. I'm sorry. What kind of walk me through if I was to call Beacon Advocates today and needed an advocate? What would the process be?
Right. So what we would do is first ask you where you are at in your journey. Some people, if you think about the cancer journey is from the screening detection to diagnosis to detection and then getting worked up to understand the severity of your disease, to the treatment phase where there's, you're actively in treatment and there could be an impasse or there's some challenges with finances or some other issues. There's survivorship after you finish your treatment, right. And there's surveillance, and then there may be even end of life issues. And so anywhere along that continuum, Beacon is able to jump in and aid. And if so, we would first find out where you're at in your journey. What is your biggest pain point? If it's just newly diagnosed is really the best because we can help you get to the right care. I can't tell you the number of people that we're finding are incorrectly diagnosed. The data has come out.
Oh, goodness.
Very.
We could do a whole show on that topic.
Right. I mean, medical errors,
yes.
That we can talk about that. I have I actually interned. I had great fortune to intern with the Institute for Healthcare Improvement, who focused on that 98,000 medical errors. They were really Dr. Berwick was just incredible in his team and focusing on improving the quality of care. So, but separately, where people are, so we can then be able to help them understand their disease, get them to the right care, to the right doctor, maybe verify even from a secondary perspective because of the severity of the discrepancies. And the discrepancies can come from pathology being not read. And in this day and age with personalized medicine and the genetic component, there are times where you need to have all of that detail. And there are other people, but that's also you're beholden to the physician's bias to doing those tests, or perhaps they're concerned because they don't believe in it, or they're concerned about they don't want to deal with the appeals process. Right. If it's denied. I mean, there's a whole host of things that can happen. And so we'd say, we can help you get the right information. We get all of their medical records. We have HIPAA forms. We take confidentiality very seriously, and we review their medical records, compare them to the evidence-based guidelines. Whatever the issue is at hand, we prioritize that. Then we go to work. So sometimes it can be insurance, trying to figure out insurance, trying to get a doctor's appointment. I can't even tell you, I had a client, one thing that comes to mind is a client that had colon surgery. He had already made an appointment, it was 8 weeks out. And I said, oh my gosh, that's crazy. So, let me call and get that. Let's get that a little bit faster. And so I called, and it turned out that not only was it 8 weeks out, but it was with the wrong practitioner. So it was with a radiation oncologist and not a medical oncologist. So can you imagine being, newly diagnosed and trying to get a treatment plan and trying to understand where you're at in the severity of your illness to have to do that? Well, thankfully we were able to get it to the right practitioner, and also within a week he had an appointment. So that's just one small sample of what we do.
It's the work you're doing is so important for the care of the patient and the family, because advocacy, it does heal us. It really does. It really does. Well, Lea Ann, let's take a short break here. And when I come back, I'm going to put you on the spot. I want to know one fun fact about you that I don't know, and our audience would be interested in learning about you. How's that?
Okay, thank you.
Okay. You're listening to Healing Ties on the Whole Care Network. We will be right back.
Hello, my name is Jody O'Donnell Ames. I'm the founder of Hope Loves Company, the only nonprofit in the United States that supports caregiving children in the ALS community.
And I'm Kara Haggerty, Executive Director of Hope Loves Company. And we would like to invite you to listen to the Healing Ties 2.0 podcast, where we'll share a little bit more about our mission and our support programs for children caregivers of ALS.
Well, welcome back, everybody. We are continuing our delightful conversation with Lea Ann Biafora from Beacon Advocates. And Lea Ann, right before we went to the break, I kind of put you on the spot and want to ask you a little bit about a fun fact about you. I mean, what it could be your hobby or something that you like to do, but what's part of your story that we don't know after talking today?
Oh my goodness, there's so many things I could go to. This is hard for me because I don't do well on this. When we process, I just don't do well with that. I find that one of my fun facts is that I'm a mother to two adopted children that are 3 months apart. So they are being raised as twins in a sense, but not really because they're truly individuals.
Right.
But that was after my husband and I were married after a very long friendship. And so I married my best friend, and it was just happened to be later on in life. And we ended up adopting, and we've been, I think that's the best part about my life right now, aside from my work and my passion about my business.
You certainly have passion for your work and your business, but how old are the kids?
They are 10.
Okay. Got a couple of more years before teenagers. So.
Oh goodness. Yeah.
Brings you back to, I love thinking about, I'm a favorite uncle. So, I have 25 nieces and nephews and 40 some odd great nieces and nephews. So if you ever need an uncle, just let me know. So.
Oh, thank you. That's terrific.
Goodness. Well, we just have a few minutes left in the podcast, and we could talk forever. And I have a sneaking feeling we're going to do a few more of these, Lea Ann, because the information that you bring and the great work at Beacon Advocates is something certainly want to be able to feature on the Whole Care Network. But let our listeners know, especially those who are in need of an advocate right now, how they can be in touch with you.
Sure. Thank you. So you could go to our website, which is beaconadvocates.com, or you can call us at 855-490-8777.
And that number again is?
855-490-8777.
Lea Ann, by the stories you share and the resources you provide and the comfort you bring by your words, actions, and deeds, you and the entire staff at Beacon Advocates are certainly creating healing ties all around us. I can't thank you enough for joining us today. It's been delightful.
My pleasure. Thank you.
Well, that does it for this episode of Healing Ties 2.0. It's really great to be back on the air with Healing Ties. As you know, I'm your host, Christopher McClellan. I'm creating a life to love after caregiving ends by sharing stories, resources, and being with awesome people like Lea Ann Biafora. Healing Ties is produced in the posh studios of Oddbox Productions in downtown St. Louis and is a part of the Whole Care Network. Check out our new website at thewholecarenetwork.com, and remember, you'll get a chance to meet Bo. And be sure to subscribe to Healing Ties wherever you listen to your favorite podcast. We'll see you for another episode of Healing Ties real soon. Thanks for listening. Bye for now.
Ciao.
This is WCN, the Whole Care Network. You talk, we listen.